Hey everyone, my name is Anna Murdoch, and today we're going to be going over how to administer medications to an infant. When we refer to infants, we're talking about children who are between 1 month and 12 months of age. And the preferred site for intramuscular injections for these babies is the vastus lateralis muscle. The preferred site for subcutaneous injections is the fatty part of the upper anterior thigh. So we'll go over how to find those landmarks here in just a minute. Make sure you refer to the PowerPoint presentation on the preferred needle gauges and length based off of the child's age. To prevent injury when you're giving an injection to an infant, it's best to immobilize the baby. And we want to prevent injury to not only the patient, but to you as the nurse who is giving the injection. So if you think about it, if a baby's able to move and kick, they might swat, they might accidentally hit the needle, causing an unintentional needle stick. So we don't want that to happen. And there's a couple different ways you can immobilize. So the first way I'm going to show you is to swaddle the baby. So what we can do is we can wrap the baby up, immobilizing his hands so he's not able to swat at us and knock the needle out of our hand. And then you're going to want to pull out the leg that you're planning on using for the injection. So this way, I have him nice and secure. That's going to help keep him comforted during the injection, and it's going to prevent him from kicking me or swatting at me because I have him nice and swaddled this way. Another option for immobilization is to have the parent or caregiver stand at the top of the baby's head, and that they can secure the arms that way. So we're going to demonstrate that now. You can have them simply cross the arms across the chest, kind of have their face near the baby, because if they're talking to the baby, that can help keep them calmer during the injection because they're seeing a familiar face. So in that way, I have the parent securing the arms, and I have nice access to his leg to give the injection. So now I'm going to show you how to find the location to give your IM injection. So just like you do with adults, you want to look at the leg, the upper thigh, and divide it into thirds. So we're going to start at the greater trochanter, which is way up here, and go to the patella. Then you're going to divide the thigh into thirds, and you're going to go and inject in the middle third just a little bit laterally. So when I'm giving the injection to this baby, I'm going to do it right about here. One technique you can use if you're having difficulty finding the muscle is to hold the baby's leg, and you can kind of make it, move the leg around, turn it, and see if you can see that vastus lateralis muscle actually pop up. And it can be kind of difficult because babies typically have chubby thighs. So the more you play with it, the more you feel it, you can feel that muscle pop up, and then you know you're in the right location for your injection. To find the location for a subcutaneous injection, you are going to look on the thigh. You can see this baby has a lot of subcutaneous tissue to work with. So we're just going to look right on the anterior thigh, pinch the area up, and it's important to administer your subcutaneous injection at a 45-degree angle. Remember, when you do intramuscular injections, you're going to administer those at a 90-degree angle. If you're giving more than one injection in a leg, you want to separate it by at least 1 inch. But best practice would be, in a baby this size, if you're giving 2 injections, to give 1 in each leg. There are some comfort measures we can use when giving injections to an infant. One thing would be to let the baby suck on a pacifier while we do the injection. If the mother is a breastfeeding mom, you can have her breastfeeding while you're doing the injection. Breast milk has been shown to have some analgesic properties, so that's really neat that it kind of helps with the pain while we're giving the shots. We can also have the caregiver stand above the baby and hold a toy to use some distraction while you're working down here with the legs. Older infants particularly are distracted by toys and things with bright lights or movement. And one other thing we use is oral sucrose solution. It's basically just sugar water, and it's used as an analgesic for young babies, particularly those that are less than 12 months of age. And for best results, you want to give that about 2 minutes before the injection, and then allow the baby to suck on a pacifier after administering it. Now we're going to go over how to administer oral medications to an infant. So it's always important to remember we never want to lie the baby flat when we're giving oral medications. This puts them at risk for aspiration. So you're going to need to position them in an upright or a semi-upright position. It's also important when you're positioning them to secure the arms, because we don't want them to swat and knock the syringe out of our hands. If you have a parent or caregiver, they might be the one to cradle the baby, and the baby might be a little more calm with someone that they know. But sometimes you don't have a caregiver and you have to do it yourself. So you always want to give your medications with an oral syringe. At some institutions, the oral syringes are different colors than the ones that we use for IV administration or intramuscular administration. So just be familiar with what your facility uses. It's also helpful to have a passy nearby because that can aid in our administration. So when you're giving the medication, we want to make sure we're squirting into the cheek pockets and not directly down the baby's throat, because that can make them choke, or they might spit out the medication because it might cause them to cough. So let's administer this med to this baby. So you want to squirt into the cheek pockets, little by little. Give the baby time to swallow before you administer more medication. Sometimes having a passy handy will help the baby suck the medication down. Infants are usually cooperative with administration when you compare them to toddlers because they are much more suspicious and scared of new people. Sometimes you can use a nipple from a bottle to give a medication if the baby's having a hard time swallowing. So you would just take the nipple, let's say this was a nipple from a bottle, there will be a hole in the bottom. You could put the medication in the nipple, give it to the baby to suck on. We do want to avoid mixing medication in a bottle of milk because the baby might not drink the entire bottle and therefore they won't get the medication.